need speakers.
Paposta na ako ng mga virus.
Yes. Maybe let's have a few. Dr. Asco, when it comes to these patients with adult deformities, is there anything you'd like, us to keep in mind in general whenever we encounter one of these patients in our clinic, in terms of perhaps their lifestyle? What sort of approach would you offer to them in terms of diagnostics and management whenever they come to you?
In adult spinal deformities, it is usually that these patients will seek consult due to disability rather than deformity. So, to ease the disabilities and the pain that is the complication of ASD is the primary goal. And the patient is also should also be his goals should also be recognized because disability and pain is really the main main problems in these patients.
Yeah,
And the
so
main-
it's more like, it's mainly the symptoms that are more their concern, no
Yes.
longer too much of the deformity.
Yes, as compared
Yes.
to the idiopathic scoliosis in adolescent, wherein the disability is, wherein the deformity is
More the
main
aesthetics,
concern.
more the cosmesis.
More of aesthetic.
I see. Yes. Okay. Now, Dr. Ong, when you were mentioning, it looks like ever since AB's attempt to come up with a classification system for these deformities. Although AB, I think, was more focused on scoliosis, on the adult scoliosis. Given all that's come out so far, in terms of repeated attempts by other institutions and physicians to come up with their own classification for adult deformities. Right now, based on what you've seen, does any particular one of them seem to be applicable? Or which ones do you think seem to be most useful or applicable for our needs?
Okay, based on, well, the most widely commonly used classification is the SRS Schwab classification because, as previously mentioned, the sagittal modifiers are very related to the patient's symptoms and also the curve severity. But, well, as the multiple classifications have been developed, not all of them still have reached a very good universal classification for each adult spinal deformity patients. But I agree also with in the lecture of Dr. Glassman that well, there has been some classification systems that have been tried to that have tried to that should include age-related lumbar lordosis measurements or at the degree
More
of
of the
severity.
age appropriate.
Yes, yes, because as he mentioned, as the patient ages, the lordosis also changes. So it's also important to remember that we shouldn't overcorrect that the lumbar lordosis of these patients because also as he mentioned the sagittal and the sagittal plane and the lumbar lordosis are the real main culprits for adult spinal deformities.
Yes. So, do you think that any of these ultimately, is there one that we should sort of adapt to our needs ultimately here, or do you think we should just continue looking to see which one is more applicable
Well,
for our needs? Yeah.
Well, the way I see it, well, we can use this SRS Schwab classification because it's really, because it's, I mean, it's descriptive. It's also very helpful in classifying these patients. However, I still believe that there should be more classification systems that should be developed to be able to consider all the factors of each patient.
Okay, thank you. And do we have any other questions from the floor? Clarifications, reactions? Yes, yes, Dr. Estelio.
Good morning. I have to remove my mask. Thank you very much for your lectures. We rarely talk about adult deformity. Of course, mas madalas yung sa mga bata, di ba? But what are the attributes of adult spinal deformity that we cannot simply apply yung pediatric or yung AIS? What are these, just to try to simplify it, kasi medyo a lot to digest eh. Pero what are the attributes of adult spinal deformity that we cannot simply apply the principles of AIS? My second question is, sige yun na lang muna, sir, and then I'll have a follow-up question.
Basically, it's really, for me, it's really more of the deformity that we consider in the pediatric or the adolescent idiopathic scoliosis. However, in the adult idiopathic scoliosis, more of the symptoms really that we treat. No? It's more of the pain, the disability that the patient feels as compared to the deformity that they see in the adolescent age group.
In adult spinal deformity, it's more of a sagittal problem
Yes,
rather
yes.
than a coronal problem, right? Okay. And for the principles of treatment, let's say for the classification, so you said Schwab is the best guide. Is that the best guide for treatment also?
However, the SRS Schwab classification doesn't have a specific treatment modality for ano po eh. That's why I believe that that's why there's so many classifications still being developed because not all of the classification systems still have a definitive treatment for or that fit for each patient po.
Okay, all right. Thank you, Dr. Esteliore. Okay, if there are no further questions or classifications, we'd like to invite the case presentation from Dr. Ryan Carnero from the Philippine Orthopedic Center. It's a case of severe kyphosis in a patient with ankylosing spondylitis. Yes. Okay, Dr. Carnero.